So this is something, an important slide I would like to emphasize, that everyone has to understand the temporal profile of the illness, how it starts and what all it does. So everyone has to understand this. If you see the symptomology, the virus, what we consider the viremic phase, and the other green thing is the inflammatory phase. So the inflammatory phase can extend to anywhere almost. If you see the whatever the graph, the curve it takes, it's the peak at the right from the symptoms starting, the peak of the inflammatory phase you see at the end of first week, and it continues to almost till end of 4 week. So this is the commonest thing what we come across. That's what the acute COVID-19. And if you notice, it hasn't touched the baseline, but it continued for further period. So that is subacute COVID-19, which extends anywhere between 4 weeks to 12 weeks. And what all the symptoms the patient can come up with, if you see in the chronic phase of the COVID-19, it is fatigue, extreme fatigue. This is what a lot of people come up with, and decline in quality of life. So muscular weakness, joint pain, dyspnea, cough, persistent oxygen requirement. This is much less compared to mild, moderate, and severe. If you see, the oxygen requirement is directly proportional to the significant involvement during acute COVID-19. If patients who don't belong to that severe category, their oxygen requirement might be will be definitely less compared to the people who actually had a very bad phase of illness in during acute period. I mean to say, people whoever were dependent on oxygen, whoever went into ICUs or were on mechanical ventilatory supports. So these people definitely required a longer duration of oxygen support. So next, neurological symptoms: anxiety, depression, sleep disturbances, post-traumatic stress disorder. So cognitive disturbances, that's brain fog. This is the most characteristic complaint. A lot of people come up to your outpatient. So palpitations, chest pain, thromboembolism, chronic kidney disease, and hair loss. Much more. In fact, there is a huge list which we can always discuss when you're talking about post-COVID. Post-COVID can be anything. Post-COVID can be anything until and unless proved otherwise. So, what are the risk factors? Whom did we notice people land up in post-COVID or the long COVID? Yes, gender. This is the literature has clearly noted that post-COVID is expected twice common in women compared to men. Increasing age, that of course every one of us know. It is found that patients with long COVID are around 4 years older than those without. The presence of more than 5 symptoms in the acute stage of illness. So as I was talking about, people who had more symptoms in the acute phase of illness can have more, extended period of chronic COVID or long COVID. And one more paper was, I think it is in Nature, it is in Lancet. They also quoted that people who had mild symptoms in the acute phase of illness are also noticed to have this long COVID symptoms. So prolonged COVID or long COVID or chronic COVID, it is nothing like anyone can escape out of this. Anyone who had COVID can be a part of post-COVID if they have escaped the acute COVID, is something which we always have to remember. Then other important risk factor, presence of comorbidities. This is the next slide. Yeah, the COVID-19 cascade leading to mortality. So everyone should be aware of this is what it happens. So during COVID, we have this viremic phase and inflammatory phase. Inflammatory phase, this SIRS, ARDS, septic shock, and multi-organ failure. So when we have a quick response that we suppress the inflammatory cascade at the earliest point, we avoid all these complications. But still, which phase? It is a spectrum. Let it be inflammation or cytokine storm or SIRS, ARDS. Cytokine storm, SIRS, ARDS are at the high end or the dead end of the spectrum. When we talk about the inflammation which is starting or the triggered, the earliest time we intervene, the least are the complications which we expect, or the least is the post-COVID syndrome which we can expect in that. So that is the reason arresting the cascade at the earliest. So acting on COVID at the earliest is always good to follow up with the post-COVID, so that they don't have much worser effects later period of their post-COVID. So again, the same graph which talks about immune response in our body, and this immune response is this is the important mechanism which is the expected causative etiopathogenesis behind post-COVID syndrome. And various pathophysiological mechanisms what we have to talk about in long COVID is, again, I mentioned in this particular thing. So you have to look into the complications, the organ damage what has occurred during COVID. You also have to check about patients' prolonged ICU stay, hospitalization, the sequel of the critical illness. So this is where you have to check about, are we dealing with a COVID, post-COVID picture, which includes a complication of COVID. So complications of COVID, just that's an entirely different topic, but still I have enumerated a few complications which we regularly come across. But coming into the proper etiopathogenesis, as every one of you know, it is immune dysregulation, which is important, which has completely put our entire entire regular mechanisms at stake. So post-intensive care syndrome, post-viral fatigue syndrome, and permanent organ damage and others are the important thing what we have noticed in the various pathophysiological mechanisms of long COVID.